sure you know the popular saying that what a man can do, a woman can do better. When women come together, a lot of beautiful, amazing, great ideas, a lot of beautiful things happen. And this brings us to the report we'll be showing this week, talking about the first edition of the annual Women in Healthcare Network, founded by Dr. Modupe Elebute Odunsi. This week, we're going to be showing you the highlights of what happened at that maiden conference. Plus, we bring you a recap of one interesting edition on Health Watch we had some time ago, and talking about sleep and self-care. You agree with me that in Lagos, because of the complexity of the city, people find it difficult to catch at least 8 hours of sleep. But look at this episode, and I'm telling you, you're going to be learning a lot of things from this week's episode. My name is Nkem Okibe. It's always a pleasure for me to do this with you every week. We'll go on a short break. When we return, then we'll take the report on the WHCN conference. Stay with us. Women in Healthcare Network held its first annual conference in Lagos on the 1st of November 2024. The aim is to bring together women in the public and private healthcare sector and also women in the healthcare discipline to connect, network to solving problems and bringing solutions to healthcare services.
Women in healthcare, as I said, is meant to bring women across sectors and across specialties together and to connect, to network, to inform and to inspire each other through mentorship programs, through leadership programs, through just supporting one another in what we're trying to do. And ultimately, to impact society, to give something back, to prove that actually, having been blessed and gifted to be who we are, where we are, we have to pull others along with us. You know, what we want to see in 5 years, in 10 years, is many more women in senior leadership positions in this country, pushing, forging, and ensuring that healthcare continues to move forward.
This year's theme was tagged Resilience in Healthcare, Thriving Through Challenges.
Many women in Nigeria healthcare face unique challenges, including limited leadership opportunities, unequal access to resources, and the pressures of balancing professional and personal responsibilities. These challenges can sometimes make our path feel overwhelming, yet I want to acknowledge the strength that each of you brings to overcoming these barriers. We are here today because we believe that together we can shape a future where women in healthcare not only have a voice, but also make a powerful impact on the industry.
The Global Sustainable Development Goals, SDG on health, especially SDG 3, which seeks to ensure healthy lives and promote well-being for all, cannot be well achieved without women in healthcare. Women, whether as doctors, nurses, pharmacists, lab scientists, or administrators, are critical to the success of this goal. We need the leadership of women in healthcare. Their impact helps to improve health outcomes, reduce mortality, foster access to essential services. That's why a program like this is very important.
The program featured amazing speakers who shared their stories, pointing out challenges encountered on their career journey. Despite all these, they are still shattering glass ceilings in their various fields.
So I've been working as a researcher for decades, and then quite recently moved on to do more administrative work. And so now I am president of Wolfson College, Cambridge. Cambridge, as you probably know, is an 800-year-old university. We have 31 colleges at Cambridge, and the colleges span in age from the very old to the more recent, newer colleges. So in our college we have about 1,000 students, about 100 members of staff, 100 odd members of staff, and about 130 fellows. And the fellows are the governing body of the college, and then it was the fellows that elected me to be president of Wolfson College. So I've moved to Cambridge now. I'm enjoying the Cambridge life. It's very different from my London-centric life. So I'm discovering new things, and I'm learning quite a lot about Cambridge.
When we listen to the stories of our sisters, I'm always struck by the similarities. They are stories of substance, of struggle, and of strength, and of triumph. And I listened today and I thought of all the things that bind us together and that continue to move us forward. My younger sister will always tell me that things in life that I often thought were setbacks were setups. They were setups for things that were greater. And by going through them, I was able to face what came ahead of me and what still continues to come ahead of me. We speak about glass ceilings, and everyone in this room has crashed through a glass ceiling. Fantastic. Can I ask you all to think about glass floors and the responsibility for us to lift as we climb?
Speaking at the event, Professor Abubakar Bello, a consultant clinical and radiation oncologist, gave a lecture on the importance of cancer screening program in women's health.
Cancers that are really responsible, infections that are responsible for cancers. About 18% globally as the incidence. But when you look at Africa, about 40% of these cancers are as a result of infection. And importantly, that some of these infections can actually be prevented. So this is very important. The human papilloma virus and the hepatitis V virus actually have vaccines, and they account for over 50% of those infections. So if we are able to do proper immunization, we should be able to reduce the incidence of these infections.
Stakeholders, policymakers present at the event commended the maiden edition of the conference, saying it's a welcome development for the women in the health sector.
There's data all over the world to show that when you bring women to the top of a table, actually things are better, particularly in the finance world where more women on the boards, the companies actually do better financially. So by actually pulling women up and increasing women in leadership positions, we want to ensure that we try and help the healthcare system in Nigeria get better.
There's power in women being leaders in healthcare, and we're trying to do our best, coming together collectively so that we can do the best we can to improve healthcare in Nigeria, quality and the kind of people that we all look after.
I think it's a very laudable project. I think they have started on the right principles, which is to promote the healthcare of women. My advice to them is to expand across the country, to continue to promote public health education.
This is Lagos State. We're very pro the feminine gender. We're a gender-sensitive government. The governor is called Mr. Gender. So we really encourage this kind of gathering where we promote women, promote their expertise, and we promote them for attaining higher heights in policy-making decisions.
Women in Healthcare Network was launched in January 2024 and is geared towards encouraging the healthcare sisterhood, mentoring, supporting one another, while also increasing the number of women in healthcare leadership.